I might be visiting you guys with a surveyor, because you don't know, you know, who the surveyor's gonna pick, or you guys are gonna pick. But just be like, you know, if I need you, I'll get you. If you have, you know, if they have questions, you know. So train them on things like that. That's the kind of stuff that they'll ask. Where would you take the patient if the house starts burning? Or, you know, have you seen me? Like, that's why if you do this, like, try to do it like at every visit now, because then, like Greg said, they'll be like, oh, you've never done this before. You know, like, what are you doing? Like, so they know that, oh, you're doing this for survey, you know. But if you start doing it now, that we're close to survey, then you're safe. At least it doesn't look like this is not what you usually do.
I got another question.
Yes.
I use a roller bag. I know I'm not gonna try to use that for the surveyor, but I just had a question about that. We shouldn't use that, period.
You can, because like, I mean, I have a bad back, but I will not use it for survey visits.
Okay. Yeah.
Just because it,
Yeah.
you know, you're rolling it around. I mean, I'm sure it still has a handle, so you can pick it up.
Yeah.
But I personally wouldn't want to pick something up that I was rolling on the floor, and then it's going to touch me, and then I'm touching the patient.
Yeah, it's not a good idea.
It's not a good idea for survey purposes,
I was just curious.
honestly. That's
It's
why I
not
don't
good
use
practice.
it. I have everything in here, and I use this bag.
Okay.
But if you have to, then
For the facility with assisted living, they have a caregiver where they keep the nurse. So the caregiver or the med tech gives the medication. How do they do the medication reconciliation?
they're going to ask them to bring out the medication. So you need to tell them that. That's another thing. Facilities are kind of thing with, you know, us being there, because there's nurses there.
So you don't.
They want to see the relationship. So have you been there? Because there's a nurse there. Is your nurse checking the patient's vitals? Like, they're noting that they are, you know?
So do you discuss the medication reconciliation with the med tech or the patient?
You can have them. The surveyor will tell you. Some will ask them to be there present. Some don't care. The med tech can bring the meds, give it to you. You do your visit and drop it off to them when you're on your way out. It depends on your facilities. I don't know, like, what kind of facilities.
And the whole point is to make sure they're taking the same things they were last time.
Yeah.
You know, the whole point.
So whether you discuss it with the nurse, because let's say the patient doesn't know her medication because they give it to her.
Fine, yeah.
MedTech is fine.
Yes.
Most of the time, you end up doing it with the medtech because patients are in assisted living. They're usually dementia, Alzheimer's. They don't know how. So it's the caregiver is the one who's in charge of their meds.
Yeah, just always make sure you're keeping up your meds. That's the number one thing, you know. And then ask your patients, because sometimes, like, if we don't see them for a couple of days or a day or whatever, or they'll go send their grandson to go buy them an Advil, and he'll be like, oh, do you have any new medication? Yeah, you know, my son bought this yesterday. Or so they just want to see how we're gonna handle that situation. You're not gonna panic. Just be like, oh, okay. So you call right there, from right there, call the office. You're like, hey, you know, I came to see Mr. Jones, and he had pain yesterday. The Tylenol wasn't working, so he sent his grandson to get Advil. So can we get so we can add the order, like, just as long as there's communication. They're not going to kill us that there's a new medication, but they want to see how would you handle that. Did you know about it? Did you ask? Did you, see? That's the important thing for them.
I have another question. For the wound care, because some of the nurse, they leave the wound supply in the patient's house, so it's already there, right? You don't have to
take
put
it
a barrier
bring it back, because
no,
you want to have it. If we put it there,
yes,
like, you want to make sure that we've put it in a box, in a bag, something that identifies that we put it there.
Yes.
And it's not, the Curlix is under the bed,
Yes.
and then the
we have a bag.
We have a container.
As long as you have something that identifies that you put it there,
Container.
and it's not been touched or then you're fine.
Okay.
But again, if you're gonna use it, no, you do need to, open a new chuck and put that stuff on there, whatever you're using.
So you put
And again, double
you still
glove
put a
for-
barrier on the
Yes.
container.
Not on the container.
So the
But you
container,
gotta take it
the
out.
wound dressing container is in the patient's house.
Uh-huh.
And you go there, you put
But
a barrier.
you want to set up your stuff, so you're not gonna. That container is now contaminated on the outside,
Right.
so we're not going in and out of that.
Right.
So again, just like you're setting up here, you're gonna set up on a different barrier. So
Okay.
you're using stuff off of that.
Okay.
It's not contaminated.
Okay. Okay.
That's her. You don't want to cross contaminate
Okay.
anything.
So you
It's
just
not just us taking it; it's them
Yeah.
giving it to you.
Yeah.
because
That's why
if
you need to.
that patient
barrier.
had something in their
right,
house,
right, right.
you could take that,
And give it to the
contaminate
next
it,
Right,
and
right.
take it to the next
Got
patient.
it. Got it.
So it's a
That's
two-way
their
street.
that's their number one
Okay,
focus is
okay.
that you're not taking things from here to there.
So once you take it out from that container, you put it on our clean area.
Yes.
Because you're gonna set a barrier.
Yes.
Yeah, you're gonna put, and again, if it's a wound care, make sure that it's a plastic bag, or if you don't have one, you have to use paper towels. Get a bag, like cut it, and then if you're using your scissors, like sanitize them, and then if you're, if you have just a regular plastic bag, cut it, open it, like put your stuff on top of that, something that's not gonna seep through.
Seep through.
Yeah.
What else?
And then the medications, just take it, like take control of your meds, take it. That's what I usually do. I'll be like, okay, like Tylenol 500, 2 taps PO daily, every 6 hours, PRN, whatever, and then she'll mark it. And then I take it, I look at them, I mark my meds, and I put them to the side. I don't let them touch it. That's just my technique. That's what I do. Because sometimes it's like one little thing is off, but we're not doing the wrong thing. It's just whatever I'm holding,
Checking.
I'm just reading and I'm marking, and they know that that's your routine. Like when they see you doing it, they know that you check it all the time. So I
So
just check it,
now
mark it off, and then
So nowadays with the surveyor, they let the nurse check it.
because, yeah,
Because when I did my survey, she took it,
and
and she
they want to
checked it
check
herself.
it. Yeah,
but now
they want
the
us
nurse
to
will-
initiate that
okay.
we're checking the meds.
Yeah, they want to see that. So MedRec is done specially for the nurses every visit. So every time you go in there, you want to check all the meds. And another thing is, if they're not using anything, have them put it in a bag and put it away. You don't want that to come up during the visit, because if
Yeah.
they have a bunch of meds that are just sitting there, even though they're not using it, then it's like
Yeah,
they
you don't
could
want
make a
them to bring it
mistake.
out.
Keep everything in a little box, shoebox type of thing, and
Mhm.
put everything in there. Because they might not tell you, and then when the surveyor asks, they just go bring out like this.
Yeah,
bag
the
of all
surveyors will love to ask this one question. This is a new question they love to ask. Do you have anything else that you like to take? Do you have any over-the-counter medications such as vitamins and some patients do, but sometimes the RN will go out because the RN didn't specifically ask. They won't show that vitamin, but when the surveyor comes, they're gonna be like, "Oh yeah, wait, I take this," and then you're like,
and
"What do you
this.
mean? No, you don't take that." Yeah,
Anything
so
they're
ask
taking
them.
needs to be on the
Well,
medication,
the
even of
special-
oxygen.
Question is something that you like to take, like vitamins.
Yeah, you want to ask your patients. Make sure you ask your patients before these surveys that like, do you guys have any other medication? Because if they do, add them on your plan of cares, because they'll check like even vitamin or like
Supplement?
joint supplement or anything.
Oxygen is a medication.
Yes,
It needs to be on the
oxygen
med
of course
profile.
needs to be on there, and then I don't. This is just a random something like came to. I don't know if you have any oxygen dependent patients, they might pick one to like go visit because they love that. But for the limits, you don't do like 2 to 3. You have to have one number now. Yeah.
And then
No.
if they have the
Right.
tanks, make sure that they're secured and strapped. They have those carrying things, or they'll not in the closet,
Yeah.
on the floor, under the bed. They're huge. And if they're on oxygen,
Need a sign.
need a sign on
Outside
the door.
of the house.
Nobody's smoking in the house. If there's an open flame,
Let's say we have the sign, but they don't wanna put it anywhere. Can we tell the surveyor?
No. No, you have to enforce it. Like
so if
I
that's
take
a
one.
that's a risk area, right? Then if you have a patient like that's the
They're
same
not
thing as if a
compliant.
patient is smoking. So if they're not compliant, you can
Discharge.
discharge them for that.
So we need.
So I
they need
take
to
one
comply.
for
Yeah.
those patients. I take one. Again, like it's a teaching tool for us, and it makes us look good. I'm like, oh no, Mr. Jones, like I'm sorry, but you have to have this outside. Now, if I walk out and they toss it,
That's fine. And then
but
put it back
the
when you come
surveyor
in.
knows that I have copy.
Just make sure
I
you
do keep
document
copies.
that.
So like I put one on the door because they'll be like, oh, I don't like the neighbor to know, but and then you tell them that that's not for you, just for you. It's for everybody. So like if the house next door catches on fire, you don't want to explode. So you want the firefighters to know that there's an oxygen running in this house.
Or if neighbors smoking.
This is gonna be the last question.
Or we're gonna start charging you.
That's great.
So the
That's
so,
free. You can cancel
Yeah,
something.
right.
so the bag, you said the trunk, right? They might look inside the car.
I guess your trunk's really dirty. Huh?
Hey, I have 3
We're
kids
gonna
that
go
move out of
down
my
like
car,
your
so-
trunk.
So I have ankle weights, I have balance pad, I have like all that stuff there. Now with the bag, do they want you to put it in a specific area?
You know what? Like I said, like I have a stroller, I have cookies, I have
Mhm.
everything in my car. You can live out of my car. But like I have this one area, like if I know like it's a survey day,
Mm-hmm.
for regular days I'll just kind of, but for survey days, if you have like, you know, the trucks, just put one out. Yeah.
Because
just
what I
put
have
it-
is 2 big
and
buckets.
just put it
That's
on
even
that's,
better.
That's
Just have a
even
barrier.
better.
And can I put
That's
my
perfect.
backpack in there with the clean
Yes.
items, right?
Yes.
Okay.
Or you could double the buckets, and then they'll ask you, oh, so what if it's dirty? Oh, I'll just take one out and I, you know, put the dirty
The
stuff.
buckets are if you have the
Perfect.
space is the best.
Yeah.
Or if you have the little, you know, the little cubicle things that we have, like we store toys and stuff in. Yeah, just throw one of those in there. They don't take any space. Just keep one in your trunk. If you get asked, that's where you put it.
Okay.
And it's not just about the survey.
Some
Like, you're
will look,
taking
some
these bags
won't.
to your cars.
Yeah.
You put your groceries there. You know,
That's
you want
gross.
it to be separate for your family too.
Yeah.
So,
Yes.
So it's, or try to put it like in the front driver's side on the floor, somewhere where it's, you know, away from people touching it or getting into it. It's just
Okay.
Yes.
And we can dispose the trash, right?
In the
As a
patient's
trash for
home?
PTAs
Yes.
because we don't do
yeah,
wound care.
yeah. Like it doesn't matter even if you do, like as long as it's sealed and it's, you know, and I'll just seal this.
You
And
just
you
ask
ask them,
You
you
ask
know,
them.
yes.
If it's
May I
okay.
dispose of this?
Dispose of
If they don't
okay.
allow it, then I'll take another bag and I'll put this in there, double bag it. That way it's double bagged, and then I'll take it out and I'll dispose of it somewhere else.
Wait, so you're saying we can use their trash? We can throw our
Yeah,
trash,
of course.
But you
Under-
need to ask them.
You need to
Okay.
ask them.
Okay.
not
Can I
bio
throw
waste,
this?
just trash.
just
Mm.
regular
Trash.
trash.
Regular
Okay,
trash,
got
like
it.
this
We got
stuff.
it.
We
Okay.
won't do that.
I thought all the trash we have to take home. No.
No, no, no,
Okay.
no, no.
Okay.
Yeah, that's a big
Okay.
That's an old school thing. Yes,
Okay.
that's how
Okay.
it used to be.
Okay.
We used to take these with us.
Okay, so we can
But no, you
use
don't
their
have
trash.
to.
Okay, as long as it's not biohazard.
Yes.
Okay.
Okay.
Okay. Cool.
So
And then
those are just stuff that you want to have, like,
Oh.
just. It doesn't have to be the red biohazard bag. It doesn't.
Okay, so
It could be any
bag.
other bag. Yeah.
But it's better
Let's
to have
double
it.
it.
It's
The
good
big-
to
the
have
double.
these. I mean, they're not that expensive. I like
Yeah.
one of my agencies gave these out, and I just have, you know.
as far as
Bunch in
writing
my
on
bag.
their folder, is that what do you suggest? Write on the folder that's the last time they have to do, like putting the vital sign on their folder. Because
No,
we leave
you
the folder
do it as you're doing it. Like have it open. I mean, it's already on their table. It's theirs. I
Right.
didn't bring it in.
right.
It's there. So
Right.
just have it there. Ask them for where's their folder.
Right.
You know, have it on the table, and just jot on it like as you're doing your visit.
Just,
Okay.
But you
And-
don't
guys
need to
record
wear-
vitals in the
Yeah.
Yes.
in the home.
And then
So-
just hand sanitize afterwards, I
But
guess.
you can.
Yeah.
Because you touch that, it's
Yeah.
contaminated.
Yeah,
because it's
yeah. You
being
always
touched.
sanitize. I mean, I'm like, even if I'm not touching anything, I'm like just randomly talking to them. I'm just like, you know, they're like looking at me like.
So I
"Rach."
guess if there's no wound, not wearing a glove is okay, right?
Yeah, it's
Just
okay.
keep sanitizing.
Yeah, because
just
I always
keep
feel like
sanitizing.
If you
gloves,
don't
you're gonna, and you might forget to.
Every
sanitize
time
in
you're gonna
between.
wear a glove and take off a glove, you sanitize.
Yeah, that's the
Sanitize
thing,
before
that's-
and after always.
So
But
before
that's
you
good.
put it on and after you take it off,
Sanitize.
sanitize.
Like I go through so many of these because it's like, you know, you're just using it all the time. But
That's fine.
Yeah.
Yeah.
Your own sanitizer?
Regular, so
Oh.
we're gonna buy those.
Yeah, the ones
So it
that
doesn't
fine.
matter if it's
Waterless, because that's what they told me.
Even the Clorox, like,
Yeah.
sandy wipes are fine.
for your
cleaning your
For your
The
supplies?
regular, the regular
Yeah.
sanitizer.
no for the no for your supplies for your
For, like,
cleaning your
stuff like that,
equipment.
Oh no,
It has to be what's on the policy.
Okay.
the policy is
Okay.
sunny wipes.
So
we-
whatever
sandy
they
wipes,
give you.
and they're really good. So it's
Yeah.
Okay.
That's what the hospitals use. So it's, you know.
sandy wipes and
That's
it's
it.
So
and
let
regular sanitizer. The one that
For
you guys
the
had
hands.
was
Yeah,
regular
the Bell
surgical
Tag.
scrub.
Oh,
That's
no.
for doing
So
surgery.
it's
yeah.
better
Yeah, it's
if
the
it's big
70%
because you just
is
keep pumping it.
the standard,
my own. I don't have
you know,
to.
national.
Yeah.
The
So-
70%.
So let's not use the sink. Make sure we're not gonna use their sink to
You
wash our
can
hands.
if you have to. I
No,
mean,
it's
like for
fine.
wound care patients, they want you to like
Oh.
wash your hands.
Okay.
And like I said, like in the beginning, like
So
keep your bag on,
okay.
have your paper towel there because you don't want to go into your bag again.
So how do you can you show them how do you normally use the sink?
Let's
to
say
make
you
sure-
wash it.
like when I had in the beginning when I showed them, like just
Okay.
have your bag there, right? And then I'll have like,
There's the sink. Let's
Yeah.
say.
and this is here, and some annoying ones will come like right there with you like that. You'll be like, so you just have this like this, like I put it out like this so I'm not reaching, and then I'll go and I'll ask them. You have to ask them.
Yeah.
"May I
So
please
your
use
bag is
restroom?"
open? That's
Well, I have to open it to get my
Okay.
paper towels out.
Okay.
Yes.
Okay.
Because I'm already in the home. I sanitized, and then I asked them, can I, because you want to sanitize before you touch their knob, if they have a bathroom knob that you're, or if you're going to use the kitchen sink or whatever you're going to use. I don't know what the patient's home's going to be like. And you have your soap, and they'll ask you what kind of soap you're using. Oh, it's antibacterial.
Oh, so
And
you have to use your own
soap.
soap, right?
Yes,
Okay.
your own soap. You cannot touch anything in the patient's home.
Your own paper towel.
Your
so
own
not the
paper
towel.
towel, your own soap, everything. You cannot touch
And
anything
you
in the
close
patient's home.
those.
So
We're guests in the home.
so I guess it's better just to
Not
sanitize.
not to use the sink, right?
Yes.
Unless it's a
No,
wound
but
care
you said
and you
if
have to.
The
if it's
patient
a
had the
wound care.
wound care. You gotta use the.
Not
sink.
initially though.
Oh,
You can
really?
still sanitize.
Okay.
Yeah, afterwards, if your hands are visibly soiled, then
Yeah.
you wash it. But if they're not, you could just sanitize.
But if worst case scenario, you
And,
have to.
and they
that's
ask
your-
you.
Yeah.
And she
And then
asks
you use your own. And then if you're gonna, turn the faucet or whatever, if you have, just turn it, or you can just, it's a shut off like this. Always use, the outsides of your hands. That's.
So
It's just like some surveyors are so weird.
Yeah.
You don't know, so
This
it's
one
hard to say.
is-
But these are the standards. I mean, if you do that much, you're fine. If they see you like religiously using your sanitizer, you're good. Like they're not out there to get us. They're not. They're nurses as well, and you'll see them. I mean, they're not doing anything. They're just sitting there watching us, right? And they'll squeeze sanitize. They're super like germaphobes, so it's like they'll go. Some are like looking and they don't want to sit or whatever. But it's just you have to see who the surveyor is. Depends.
so if it's a wound care, they have to use the sink or no?
It's not okay.
It
You can go. They
depends.
like to see it. I mean, I've done. It's
You're not
Greg. What does
listening.
their policy say?
No, you
What
don't
is your
use the
policy?
sink.
It doesn't say.
It
You
doesn't say
only
your
use the
policy.
sink if your
Okay.
hands are visibly soiled, like you got blood out, all over.
I'm the
You
Don't
can
use
use
the sink.
it either or.
either or.
Either
Just
It
sanitize.
depends if they're gonna ask, so you're prepared.
or. Okay.
So if there's a wound care, is it better to wash your hands on their sink?
In your policy, Greg says is you could use.
So,
just
like, you have a
alcohol.
wound care patient, for
Yes.
example, you walk in, sanitize your hands, then, do your gloves,
Okay.
sanitize, take off. You could just,
Because 3 years ago, one of my nurses, because she's been followed 3 times.
Yeah.
So on the last visit, she asked her to wash her hands.
she can, yeah.
Yeah, they can. And like I said, for wound
Because
care
she's been
patients,
doing
because
that.
I've
How
had,
many seconds do
like
you have
us.
to wash your hands?
For
Sing the happy birthday.
sanitizer?
1 minute.
Yeah, happy
Twice.
birthday.
15 seconds. You have to scrub.
50?
In between.
Yeah, you gotta scrub for
in terms of
15
this,
seconds.
Yeah.
50?
Then
1
really.
5.
15? Oh, 15.
And never go
the
like
ABCs.
this.
It's all like all the way up
The
here.
ABCs, yeah. No, you don't have to go up.
Okay,
You
look.
just-
And if they ask, what is your company policy for hand? It's CDC guidelines
Yeah,
for you guys to know, because there's the World Health Organization. We do the CDC guidelines.
The other place that I worked at, we were using the gate belts where it's like a like cloth material, and then they recommended to use the plastic one so you could
So
easily
you can
wipe.
wipe it. Yeah.
Mm-hmm.
Are they gonna ding me on that? Oh,
They-
you should
they
be
can.
using a plastic one because it's a lot cleaner. You could clean it easier.
How do you? And they might ask you,
I would just
how do you
usually
clean your?
sandy wipe it. I mean, I have no other choice.
Yeah, and then if she asks you or he asks you, I sandy wipe it. Again use it at the beginning of your visit.
Mm-hmm.
Wipe it. It's 2 minutes. Let it dry, and if you think it's cloth and it hasn't dried, because like this is like a I don't know what
Nylon.
That like a plastic material.
that's
but
illegal.
still
I would
needs
get
to
a
be wet.
plastic one if you can.
Yeah,
Get a plastic one.
but if not, just be like, well, I just leave it,
I'll get a plastic.
Because with the cloth, then you can really
'Cause
get
it
technical
gets
about that.
it gets really dirty. Easy.
I don't even know if the Sani wipe's gonna.
That's what I'm saying.
Can,
gonna sanitize.
Again, it depends on the surveyor.
Yeah,
so
that's what
some
I'm saying. You don't know what kind
Those
of
kind
surgery
of things,
you
like the blood pressure cuffs, like it's like Joint Commission's like thing on that, because in hospitals now every patient has their own, right?
get.
I don't know if any of you worked in a hospital or been in the hospital lately. Every patient has their own blood pressure cuff, and that's a new Joint Commission thing.
oh, wow.
They have it, yeah. So they don't do the
So use
trees
the same
anymore.
one all
No,
day.
everybody has their own. And same with like PT supplies, they order each their own. So
so plastic
that's
one
something,
is.
yeah.
Plastic.
I would go
You
with
might want to
plastic.
invest it
Like a
because,
vinyl
you know,
Infection.
it'll
Yeah.
last forever
Yeah.
anyway, you know, so. Or if you have like duct tape or something, I don't
And
know.
just duct tape
Maybe
it.
you can duct tape it and not wipe it because it's
Oh,
plastic
super
barrier.
cool. Yeah.
Just get a plastic one. I don't think they're. that
Yeah, I don't know
expensive.
if they're expensive, but if they're not for cost effectiveness, that's another.
I'm sure Jed will give you one.
Okay.
He's quiet.
He's like, "Oh, I don't know.
Okay.
Question?
I have a question.
Yes.
So for medications, some patients have express scripts and they keep sending them like multiple bottles of like one medication. Are we gonna get dinged on that if they have like
You're not
five?
You're not gonna get dinged on that, but that's
Take it
our
away.
job. So when you go in,
Take-
the last one that they have, that's the one you wanna, that's why, try to send them boxes.
Yeah.
Like the little cheapy Target dollar bin, whatever, like boxes, to store their medications. And then put the new ones in, compare it to your plan of care, and tell them to put the old ones like away. Or take them another box and tell them to store it away. Because they will for sure, trust me, pull it out during your visit and be like, oh, we have all these, what do we do with, because they love to ask, because they think like the surveyors they know their authority, so they want to ask them something that like we don't know, so sometimes they'll do that, but just make sure you have an answer for everything that they ask you.
And try to get the patients to understand that you're not there just to check blood pressure. You're there to teach them. So if the surveyor does ask them, what do they come here and do? And some patients are like, oh, they just check my blood pressure and leave. And that's not really a skilled service.
Correct.
So educate them, like,
Like-
I'm here to teach you to do this, I'm here to teach you to do that.
Yeah. Pain medication, pain, always ask them for the pain, and they might ask you like, what do you use
Like-
for, and I don't know if they have it in their home charts. Do you have the phase scale, the pain scale in your
Yeah,
chart?
they have it in the new.
Yeah. Be like, we have one here, or use that during your visit just to make it more, or start using it just so they know, because in the hospitals they have it all there. That's why.
West Mall.
The new folders have it.
And the
From
booklet?
West Mall.
The booklet has it.
The new book.
Blue folder?
The new book.
The blue folder.
I don't know, I didn't know.
After the meeting.
No, the old book.
Both had it.
Both
Yes.
have it.
But the new one?
Both.
So
Yeah.
assessing pain is, again, always reassessing.
And teaching, like if you're there, like try to make it interactive.
It-
Like
it's
let's
there.
say if your patient
It's
has two
towards the end.
medications.
I make those folders, so it's there. Oh, I'm okay.
Like physically, verbally, like in front of the surveyor, especially, like that's a good teaching. Like if they have two pain medications, teach them. Some of them don't know, or some caregivers don't know how to take the Tylenol and the Advil. Just teach them. Well, you can space it out every 4 hours, so that way you're taking this one every 6 hours and that one every 8 hours, and so the surveyor knows that you know your stuff. That's just pretty much it. And then just do your, head to toe assessment when you walk in. And
A
that's
good
just-
question to ask too is did you go to the doctor? Did you have a doctor's visit from the last time I saw you? And if they say yes, then they
Then
probably
follow
got
up.
some new medication or
New
Make
order.
sure you ask for falls, because sometimes they won't tell you that they fell, but the surveyor will ask them. The surveyor will ask, even if it's in your own language, they'll be like, okay, ask your patient if they had a fall. Oh yeah, I fell like 2 days ago. Okay, well you didn't let us know. And then reinforce that. Oh, if you ever, use your assistive devices, use your walker, use your cane. If you do have a fall, call the agency right away. So we need to keep that on file, send you extra help, blah, blah, blah.
Adrian, any more questions?
Because they catch you off guard. I'm just randomly blurting things out that I remember, like that they'll ask me. Because trust me, they will catch you off guard. Like they'll run, and it's stuff that we know. Of course, you know you've been doing this for so long. But
When you're there,
sometimes when you're caught off guard, you're like, so what do I say? You know, like, or you don't know what to answer, and then they feed off of that. They want you to not know. So they're like, oh, you know, your nurse doesn't know, you know, how to handle this. But you want to show them that you know how to handle whatever comes your way.
And then when you're doing the med rec, making sure if they're down to their last few pills, to call the pharmacy, you know, making sure that, especially during the weekends, that
Yeah.
way you save on call and all these other
Yes.
stuff for the.
Yeah, that's another. They're just coming out one by one. Yeah, so it's medication and hand hygiene are
Big thing.
number one things. Everything else, I mean, obviously we're not there to kill patients, so as long as we're practicing safe nursing, we're good.
And read the plan of care, make sure you're not doing anything outside, like taking the pulse
All
ox.
socks.
You know, if the patient doesn't need to be weighed every visit, no weights. You know, if that they need that, make sure it's on the plan of
Yes,
care.
if you have a CHF patient, please, for that visit, at least take your scale. Put it in that, don't put it in your nursing bag. Put it in a separate bag because that's dirty and we put it on the floor, so.
You guys
and
have a lot
again-
of CHF?
Do you have any CHF patients?
Yeah.
Yeah, so if you do, and if, because sometimes when they print, you know, they'll wanna pick the patients that have those type of things to see. So if you do have a CHF patient, again, if you're taking your scale, you need to put paper towels on the floor before you put your scale on the floor. Wipe your scale, have them stand on, wipe it off, put it back, and then dispose of that just as you would with anything else. So you even your scale that you put on every floor, you can't put it on the patient's floor. You need to put it on paper towels.
All right, any more question, guys?
Oh, good. I think it's.
Thank you.
Thank you very much.
Now
Hopefully it was
everybody now
helpful.
understand.
Yeah, again, it's not to teach you what to do because we all know what we're doing. We've been doing this for, you know, we do this for a living, but it's to reinforce little things that, because
Sometimes
like
it's
for me, like this is what I do for a living. I do like deal with these surveys, right, with Greg. So it's like I do them like on a weekly basis sometimes. So sometimes twice in a week, 3 times in a week. But so it's questions that they ask and know your emergency plans, know all that stuff. Like go, you know, because they'll ask you.
And
Like
the,
they'll
pa-
ask
the,
your
the
nurse
new one
outside.
is.
Yeah.
And they'll ask the patients, did they discuss the emergency management plan?
Yeah. So just tell them, even if it's a forgetful patient, be like, oh, you know, in the case of an emergency, just try to kind of jot, you know, freshen their memory, like, oh, you know, you'll go here. So if they ask the patient, they'll be like, oh, they mentioned, they might not remember it, they mentioned something about the emergency, but they'll ask you outside of your visit, so if there's a disaster that's gonna happen, where are you gonna meet? You know, so, you know, when was your last tabletop training? When did you have your last earthquake? Like, those are stuff that they'll ask the nurse outside of the visit. These are all new things. They used to not do these things, but they started asking for all staff, actually. If they're gonna be visiting with you and your staff, they're gonna ask you those things, so just know those things.
What do we? So what are we gonna?
We're gonna have another in-service for that, but we need, the plan of action would be to make sure everybody shows up, because
Yeah.
Yeah.
we only have 2 responsible nursing representatives here.
That's me, the 3.
Like, no RNs? She's an RN. So you do a lot of the starter cares?